Imagine a baby born too soon, or perhaps a baby born with unexpected health challenges. These tiny infants need special help right from their very first breath. Their journey often begins in a place called the Neonatal Intensive Care Unit, or NICU. It is a highly specialized part of the hospital. Here, a dedicated team of doctors and nurses works around the clock. They provide life-saving care to these vulnerable newborns. The environment is filled with advanced technology. Yet it is also a place of immense hope and human skill. In this critical setting, the first hour of life is incredibly important. We call this period the Golden Hour. This term highlights its precious and time-sensitive nature. Think of it as a window of opportunity. During these initial 60 minutes, specific actions can make a huge difference. These actions can significantly improve a baby's chances of not just survival. They can also improve their long-term health and development. This concept is a cornerstone of modern neonatal care. It is recognized by medical professionals worldwide. The Golden Hour is not just about medical procedures. It is a comprehensive approach. It focuses on stabilizing the newborn quickly and gently. It aims to prevent common problems faced by premature or sick babies. These problems can include low body temperature or difficulty breathing. They might also involve unstable blood sugar levels. The goal is to provide a smooth transition from the womb to the outside world. This transition can be very tough for these fragile infants. They need immediate expert support. Understanding the Golden Hour is vital for healthcare providers. It is also important for families. Knowing that there is a focused plan can be reassuring. It shows the commitment to giving every baby the best possible start. This first hour sets the stage for the baby's entire NICU stay. It can influence their recovery journey in profound ways. The care delivered is precise and carefully timed. Every minute within this hour counts towards a better future for these little fighters. It is a testament to medical progress. Newborn babies, especially those born prematurely, are incredibly delicate. Their bodies are not yet fully developed. Their organ systems are still maturing. This makes them very susceptible to the stresses of birth. It also makes them vulnerable to the challenges of adapting to life outside the womb. For instance, they struggle to maintain their body temperature. Their small bodies lose heat very quickly. This can lead to a dangerous condition called hypothermia. Hypothermia can cause many other problems for the baby. The Golden Hour is so crucial because it directly addresses these vulnerabilities. Immediate attention to warmth is a top priority. Babies are often placed in special warmers or incubators. Their temperature is monitored closely. Another major concern is breathing. Premature babies often have underdeveloped lungs. They may need help to breathe properly. This help can range from gentle oxygen support to more advanced ventilator care. Starting this support promptly is essential. It ensures the baby's brain and organs get enough oxygen. Furthermore, these tiny infants can have unstable blood sugar levels. Low blood sugar or hypoglycemia can be harmful if not corrected quickly. During the Golden Hour, blood sugar is checked. If needed, the baby receives glucose to stabilize their levels. This helps protect their brain development. The first 60 minutes are also critical for preventing infections. Newborns have immature immune systems. The medical team takes great care to maintain a sterile environment. They follow strict hygiene protocols. This reduces the risk of infections. Essentially, the Golden Hour is a proactive strategy. It aims to anticipate and prevent complications before they escalate. By addressing potential issues immediately, we can reduce stress on the baby's fragile system. This allows the baby to conserve energy. This conserved energy can then be used for growth and healing. It is a period of intense, focused effort. This effort lays a foundation for better health outcomes. It is truly a race against time. The stakes are incredibly high for these little patients. What exactly happens during this critical first hour? It is a carefully choreographed sequence of events. This sequence involves a multidisciplinary team. Doctors, nurses, and respiratory therapists work together seamlessly. As soon as a high-risk baby is identified, the team prepares. This preparation often begins even before the baby is born. They ensure all necessary equipment is ready and functioning. This includes resuscitation equipment, warmers, and monitoring devices. Communication is key among team members. Once the baby arrives, the focus is on immediate stabilization. The APGAR score, a quick assessment of the baby's condition, is noted. Gentle drying and stimulation are provided. The baby is placed under a radiant warmer to prevent heat loss. If the baby needs help breathing, this is addressed straight away. This might involve clearing the airway. It could mean providing positive pressure ventilation, or in some cases, inserting a breathing tube. Every action is performed with precision and care. The goal is gentle, effective support. Simultaneously, vital signs are continuously monitored. This includes heart rate, respiratory rate, and oxygen saturation. Intravenous (IV) access may be established. This allows for the administration of fluids or medications if needed. Blood samples are often taken. These samples are used to check blood sugar levels and other important markers. Early administration of surfactant, a substance that helps lungs expand, might be necessary for very premature babies. This can dramatically improve their breathing. All these interventions are evidence-based. The golden hour also involves minimizing stress and handling. While essential procedures are performed, the team strives to be gentle. They aim to reduce noise and bright lights as much as possible. This creates a more womb-like, calming environment. Skin-to-skin contact with the mother, if the baby is stable enough, might be initiated. This practice, known as kangaroo care, has many benefits. It helps regulate the baby's temperature and heart rate. It also promotes bonding. Every step is carefully considered for its impact. Focused interventions during the golden hour yield significant benefits. These benefits contribute directly to the newborn's immediate survival. They also influence long-term health. One of the most critical benefits is improved temperature regulation. Maintaining a stable body temperature is essential. It helps prevent a cascade of metabolic problems. When a baby is warm, their body does not have to work as hard. They can conserve precious energy for growth and fighting illness. This simple step is profoundly impactful. Another key benefit relates to respiratory support. Prompt and appropriate assistance with breathing ensures adequate oxygen supply. Oxygen is vital for brain function and organ health. By preventing hypoxia or low oxygen levels, we can reduce the risk of brain injury. This can have lifelong positive consequences. Early respiratory management can also decrease the need for prolonged mechanical ventilation. This, in turn, lowers the risk of lung damage. It means a healthier start for the baby's lungs. Stabilizing blood glucose levels is also a major achievement of the golden hour. Hypoglycemia in newborns can lead to seizures and brain damage if not treated swiftly. Early screening and intervention protect the brain. This ensures it has the fuel it needs to develop properly. This is particularly important for premature or small for gestational age infants. These babies are at higher risk for low blood sugar. Careful monitoring and timely glucose administration are vital. Furthermore, the golden hour protocols help reduce the incidence of severe complications. These include conditions like intraventricular hemorrhage, bleeding in the brain. They also include necrotizing enterocolitis, a serious intestinal illness. By stabilizing the baby quickly, we reduce physiological stress. This lessens the likelihood of these dangerous conditions developing. Overall, the golden hour approach leads to shorter NICU stays. It improves survival rates without major disability. It provides a foundation for healthier lives. It is a truly powerful intervention. To make the golden hour truly effective, hospitals adopt specific best practices. These practices are based on the latest research and expert consensus. One core principle is preparedness. This involves having a dedicated, well-trained resuscitation team available for all high-risk deliveries. This team should be familiar with golden hour protocols. They should regularly practice through simulations. This ensures everyone knows their role and can act quickly and efficiently when the time comes. Standardized checklists are another important tool. Checklists help ensure that all critical steps are completed. They reduce the chance of human error, especially in high-pressure situations. These checklists is key to improving outcomes across the board. Minimizing interruptions and unnecessary handling is also a best practice. While assessments and interventions are crucial, they should be clustered. This allows the baby periods of rest. Excessive handling can cause stress and lead to instability in very fragile infants. Finally, early involvement of parents is increasingly recognized as a best practice. Keeping parents informed and involved in decision-making is crucial. This family-centered approach is integral to holistic neonatal care. It acknowledges the vital role parents play and fosters a partnership between the family and the medical team. Experts across the globe consistently emphasize the importance of the golden hour. Dr. Anup Katharia, a leading researcher in neonatal resuscitation, often speaks about this. He highlights the aggregation of marginal gains. This means that many small, positive changes made during the first hour add up. They collectively lead to significant improvements in outcomes. His studies have shown tangible benefits. These include reduced rates of hypothermia and better cardiovascular stability. This research underpins many current protocols. Experts also stress the need for ongoing training and quality improvement initiatives. Dr. Maria Gillum-Krakauer, another prominent neonatologist, points out this. She notes that golden hour protocols are not static. They must evolve as new evidence emerges. Regular team training, simulations, and debriefing sessions are essential. These activities help refine skills. They also improve teamwork and communication. This continuous learning approach ensures that care remains at the cutting edge. It ensures optimal outcomes for babies. Furthermore, specialists underscore the importance of a systems-based approach. Everyone plays a role in ensuring a smooth and efficient process. Adequate staffing and resources are also crucial. These elements must be in place to support the complex needs of these infants. This ensures the team can function effectively. Recent studies continue to reinforce the value of specific golden hour interventions. For example, research published in the Journal of Perinatology in early 2025 highlighted this. It showed that adherence to a standardized golden hour bundle significantly reduced mortality. It also reduced major morbidities in extremely preterm infants. Experts like Dr. David Sweet from the UK often cite such studies. They use them to advocate for wider adoption of these life-saving practices. The evidence is compelling. The consensus among experts is clear. The care provided during the golden hour does not just affect a baby's immediate survival. It has far-reaching implications for their long-term health and development. By preventing early complications, we can significantly improve a child's future quality of life. For example, avoiding brain injury during this critical period is paramount. Brain injuries can lead to lifelong disabilities. These include cerebral palsy, learning difficulties, and developmental delays. The golden hour helps protect the developing brain. Similarly, protecting the lungs from injury in the first hour can prevent chronic lung disease. This condition, also known as bronchopulmonary dysplasia, can affect premature babies. It can lead to breathing problems throughout childhood. Gentle ventilation strategies and timely surfactant administration are key. These interventions reduce the risk of long-term respiratory issues. This means fewer hospital readmissions. It also means better lung function as the child grows. This is a significant long-term benefit. The nutritional support initiated during or shortly after the golden hour also plays a vital role. Early establishment of IV fluids and, when possible, early feeding with mother's milk is crucial. This supports growth and development. Good early nutrition helps the immune system mature. It also aids in gut development. This can reduce the risk of infections and feeding problems later on. These are all important factors for long-term well-being. They contribute to a healthier childhood. Ultimately, the goal of neonatal care is not just survival. It is to ensure that these tiny patients can thrive. We want them to reach their full potential. The golden hour is a critical first step on this journey. By optimizing care in these initial moments, we lay a stronger foundation. This foundation supports better neurodevelopmental outcomes. It supports better physical health. It supports a brighter future for these vulnerable infants. The impact extends far beyond the NICU doors. It lasts a lifetime. Researchers are continually seeking new ways to improve outcomes for vulnerable newborns. One area of active research is non-invasive monitoring. Scientists are developing new sensors and technologies. These can provide detailed information about a baby's condition without needing invasive procedures. This reduces stress and the risk of infection. It allows for even more precise adjustments to care. Another exciting development is the refinement of resuscitation techniques. This includes exploring different approaches to respiratory support. For example, less invasive surfactant administration, LISA, is gaining traction. This method avoids intubation for some babies. Delayed cord clamping is another practice with growing evidence of benefit. It allows more blood to transfer from the placenta to the baby. This can improve iron stores and reduce the need for transfusions. These innovations are making care gentler and more effective. Personalized medicine is also beginning to find its way into the NICU. Researchers are studying how genetics and other individual factors influence a baby's response to treatment. In the future, we may be able to tailor golden hour interventions more specifically. This could be based on an individual baby's unique risk profile.